So Upper Samieston, family farm in business, myself and my parents David and Isabel. Upper Samieston itself owned 1,000 acres ranging from about 400 feet sea level up to just over 1,000. We rent another farm, Greenside, on a 5-year SLDT, which we've been there for 10 years now. It's a bit lower ground, better fields, and we've got another small farm in between, so there's 4 miles between Greenside and Upper Samieston. We run 450 suckler cows, 500 ewes, and we have about 300 acres ploughed between winter barley, spring barley, whole crop and forage crops. So our weaning strategy has changed over the years from doing an abrupt weaning, as in bringing cows and calves in, treating all the calves with everything that they get and taking them away from their mums all in the one time, to now doing it on a slower, easier, less stressful way by bringing them in, doing everything we want to do to the calves, and then putting them back to the shed with their mums with access to a calf creep area. And so the cows teach the calves to come forward to the feed barrier, show them what the silage is. The calves are relaxed, no stressed. They continue to get creep feeding, and then after they've been in for a week or 10 days, then we close the creep gate and leave them for two to 3 days until they settle down across the gates from their mums, and then after they've all went quiet, we take either the cows away to their winter accommodation, or the calves go to their winter accommodation, and that's it. 2021 we had a really bad go with a pneumonia that we'd never heard of before called H. somni, which was brought on due to stress. We looked at vaccine options and decided to try a reduced stress weaning instead, and since doing that in 22, we've not had to jag a calf for pneumonia since.
So in 2021, Ian and the herd had an outbreak of Histophilus somni at weaning time. So Histophilus somni is a bacterial infection that can cause really severe pneumonia. In 2021, Ian weaned the calves as he always did in an abrupt manner. Calves came off the cows and straight into the sheds. The sheds that he used at Samieston, where the problem was, were quite densely stocked, and we think that is a significant factor, and that was a change from what he would normally do that caused this outbreak. Histophilus somni is a tricky disease because it can present in lots of different ways. So he wasn't saying immediately the classic pneumonia signs, he was saying lame calves. But it can also present as meningitis, sudden deaths. It can sometimes present as calves that have got eye problems as well. But Histophilus also attacks muscles, and especially the heart muscles. So sadly what happens in these situations is you have your first wave of illness, everything settles down for 4 to 6 weeks or so, and then suddenly the calves start going down with acute heart failure and basically dying within a day or two. So Ian suffered quite significant losses. He had 10 to 15 calves lost in a group of about 200. So that led us on to the discussion. There is a vaccine available, but sometimes it's not the panacea that everyone expects it to be, and it's very important to tackle the other environmental factors that can play a part in pneumonia, and that's what's led Ian to change his weaning strategy here. So nutrition is really important at weaning time. It's a huge shift from calves at grass with their mothers, eating grass, drinking milk from their mothers, potentially with a creep feeder available to them, to coming in to being in a housed ration where they're eating silage and concentrates or whatever the ration may be at the feed barrier. By weaning cows and calves together, the calves have the opportunity to learn from the cows. The cows know when the feeder wagon's coming in, and they'll get excited and come forward to the gate or the feed barrier to feed, and the calves learn from that. So it takes away one massive stressor from the calves at weaning, and just by having that process with the cows being there at the same time, it allows the calves to learn what they're doing, and they start motoring and they start eating a lot better, a lot more quickly. Post-weaning, your signs of pneumonia, sometimes it can be as simple as the calves hanging back, it's not coming forward to the feeding. The first thing you tend to get before you get the classic snottery nose and weepy eyes is a high temperature, and so the calves, their ears are down, they're maybe not eating as well as they should do. That'll be your first things to look for. The system of gentle weaning and housing the cows and calves together for a period prior to weaning has really been beneficial at Upper Samieston, because it's allowed them to reduce a massive amount of the stressors that occur at weaning time, and therefore the calves have transitioned much better and continued to grow well and not had the check that they sometimes classically can get at weaning time.
So the key considerations at weaning beef calves are really we're trying to mitigate against the stresses involved. Weaning inherently is a stressful situation. If it were to happen naturally in an extensive wild type situation, if we look at wild bison for instance, they would probably wean their calves at 12, 14 months of age. We're asking our beef sucklers to wean at 6, 7, 8 months of age. So inherently, those animals are a lot younger. The effect of that is that they are more reliant on mum for milk as a food source. So anything from 15 to 20% of their food intake, up to in the smaller end of our calves, 50, 60% of their food intake will still be milk at the point of weaning. And so we have, I guess, a nutritional stress there. Now we can mitigate against that by looking at starting creep feeding in anticipation of weaning, by looking at offering higher quality forage to these animals. So there are mitigations there, but we've definitely got a nutritional stress. We've also got, I guess, an environmental stress, I would call it. So calves get very habituated to their environment. They need to know where things are, and they get taught by their mothers how to feed, where the water trough is, etc., etc. And at weaning, sometimes these animals will be moved to an unfamiliar environment. And the consequence of that is that it's stressful, because if you don't know where the water trough is, or if the water tastes differently because it's piped as opposed to spring, whatever, then that creates a stress. So there is an environmental stress. Post-weaning, we have to consider various health issues, but far and away the most important, significant one is going to be bovine respiratory disease, also known as calf pneumonia. It is over 50% of all mortality is associated with pneumonia. And so therefore, that's a big gain for if we can target that specific disease or complex of diseases. Now, calf pneumonia is affected by many different things. We've had a good discussion today on farm about the effect of housing and how correct housing can really improve ventilation and improve calf health in that sense. But in terms of pneumonia, we want vaccines in preemptively. So we want to cover for the routine viruses that are implicated in calf pneumonia. We want those vaccines to be on board in good time, before housing and before weaning ideally. And then we want the management to be quite slick. We want all our procedures to have been done beforehand. We want to be either weaning outside, obviously ventilation, as you can see today, is very good, or we want to wean into a well-ventilated shed that's dry and is appropriate for the animals. But far and away, the biggest disease at this time of year, post-weaning in spring calving cows, and to some degree in autumn calving sucklers, is pneumonia. I think the mistakes that we commonly see that are made at weaning are often made because many farmers will be using a system of this is what we have always done. Now, I am very aware that some of procedurally what is done at weaning is dictated to by shed availability or just by the very nature of the setup of the farm. If we've got an extensive hill farm, there may be little or no calf accommodation. Those calves may be weaned directly off the mother and sent to market. So in many ways that's not ideal because that calf is then undergoing a significant amount of stress, being moved away from its mum very abruptly and then potentially mixed with other cattle, maybe going through a mart and then maybe on to another farm. That's not a mistake as such, but it's obviously just a consequence of certain types of farms. I think what I would try and target on certain farms that have the requisite accommodation is just trying to think a little bit more about how that calf is going to feel at weaning time and trying to reduce its stress and ultimately improve its outcome in life, reduce its chance of getting pneumonia and so forth. And if it's something as simple as, well, we heard today how Ian is using creep in a forward sort of basis, so feeding his calves creep in preparation for weaning and then using that as just the creep gate is closed off at the point of weaning. So he's reducing the stress, if you like, associated with the nutritional deficiency of weaning, but also he's doing it in a stepwise manner so that, you know, the bond between the mum and the calf is broken over a prolonged period rather than the stick and plaster abrupt weaning. Disease outbreaks after weaning, we've talked a little bit about pneumonia. It's really about having a steady system, a well thought out system. It's providing what these calves require in terms of nutrition. So it's having nutritional analysis done of the forage, having an understanding of what we're trying to achieve in terms of growth rates, not mixing, you know, so keeping the groups very steady, not introducing new cattle if it is a system where they buy in store cattle, for instance. We really want them to be different shed, different farm, different area certainly. So it's keeping everything very stable. It's keeping uniformity in management. It's looking at ventilation within the shed. It's looking at moisture levels within the straw. It's looking at quality of all of this. And I suppose it's looking at it as a whole, as opposed to, which I have seen, and I think the veterinary industry to some degree is guilty of assuming that a batch of calves are vaccinated for certain diseases against pneumonia, and therefore incorrectly assuming that that means they won't get pneumonia, which is simply not the case. So we need to use our vaccines wisely, we need to have them on board in good time, but we need to marry that up with continued good management through the winter in order to minimise disease risk. So I guess if I was to summarise my advice today, what I would suggest is that we need to use calf pneumonia vaccines appropriately. Ideally, we want them to be given to animals that are less stressed as they can be, because vaccines essentially will not work well in an animal that is overly stressed. An overly stressed animal has a poor immune system. It's going to react poorly to that vaccine. So albeit you think we've covered for everything, I'm not sure we have. So in terms of calf pneumonia, weaning and housing, we need to look at that. We need to mitigate against the stresses that we've already covered, and we need to look at our accommodation. And if we combine good accommodation, reventilation and so forth, strategic vaccination, we can massively improve on these losses that we talked about. Over 50% of all post-weaning deaths in Scottish suckler calves are to do with pneumonia. If we can dial that number down, then we have achieved quite a lot.